All right, now we have the next vertebrae. All of these vertebrae are associated with and make up the thoracic cavity, and they're all connected to ribs. There's 12 of them, and they're called thoracic vertebrae. So the thoracic vertebrae have a really pointy kind of spinous process, and they have something unique right here, and that's where the head of the rib articulates with this vertebra, and this little spot is called the superior demifacet. There's one underneath here that would be stacked on top of here, and the rib would articulate with both of them, and that's called the inferior demifacet. And then we can see this spinous process. We can see the body up here. We can see the spinous process. This is the lateral view. This is the posterior view. We can see the spinous process here. And then we can see the inferior articular process, and what's not labeled, but we can see it real clearly right here, is the superior articular process of the thoracic vertebrae. So once again, thoracic vertebrae are labeled T1 through T12. And T1 is the first one that articulates with a rib. So on the exam, you may be asked to identify a specific vertebrae on the skeleton, and you'll have to count up or down, however you decide to do it. So there's 7 cervical vertebrae, then there's 12 thoracic vertebrae, and then there are 5 lumbar vertebrae. They form there are these 5 large vertebrae on the lower back. There's no new structures on these lumbar vertebrae, but I'll tell you that they're quite large. The body is quite large because they bear a lot of our weight. And so there's 5 lumbar vertebrae, and they are labeled L1 through L5. So the way to remember cervical, thoracic, lumbar, we're going superior to inferior here. Cervical, there's 7. Thoracic, there's 12. Lumbar, there's 5. And you could remember it like you eat breakfast at 7 a.m., you have lunch at 12 p.m., and you have dinner at 5. Maybe you don't, but that might help you. All right, we have the sacrum and the coccyx. This is what people call our tailbone. The sacrum is made of 5 vertebrae, you can even see, that are fused into one bone called the sacrum. So these parts, each one of these, they're called S1 through S5. I'm not going to ask you that on the test, but I want you to know that they are 5 fused vertebrae. Same thing with this is actually literally the tailbone. We're on page 85 here. And this is made of 4 fused vertebrae, and they're labeled CO1 through CO4. I'm not going to ask you to identify them separately, but I want you to know that there are 4 fused vertebrae that make up the coccyx, that there are 5 that make up the sacrum. Okay, here are the curves of the vertebral column. We have a vertebral column, 1 vertebral column in here, and the first curve is a little bit of an arch, and that is called the cervical curve, and then it rounds out to kind of allow space for the thoracic cavity, the lungs, the heart, and it kind of curves out, and that bend is called the thoracic curve, and then it arches back up again in the lumbar area, and that's called the lumbar curve. Very simple, okay? You can see also that this one has actually a herniated disc. So in between each vertebrae, there is a fibrocartilage structure that has a gel-like center, and this is called an intervertebral disc. And sometimes that gel kind of oozes out to the side. It's extremely painful. If you've ever known anyone with a herniated disc, oftentimes these nerves get compromised, and let's look at those a little bit more clearly. Here's our disc model. So on this intervertebral disc over here on the left, we can see that there's a ring-like structure, and that is called the annulus fibrosus. In the middle, that gel structure is called the nucleus pulposus. So you might need to be able to identify those different structures. I outlined them here, maybe you want to too. And then we show stages of how a herniation might work. The nucleus pulposus is inflamed right here. It's usually from too much sitting. It could be from an injury. It starts herniating into that annulus. This one herniated all the way through. You can see that it's pressing on the spinal cord. This person's in a lot of pain, okay? And I just want you to see that spinal cord and those spinal nerves, and that can create a lot of dysfunction for people. Once again, here's the spinal curves from the side, from the lateral view. Here's the cervical curve here. It's a little bit of an arch. This rounds out a little bit, and that is the thoracic curve. Down here, we have the lumbar curve, and here we actually also show the sacral curve. That's page 87.